personally salute all frontliners who have worked tirelessly and innovators who have yielded a solution to prevent and treat COVID-19 and other crisis situations, or an initiative which has contributed towards mitigating the impacts of coronavirus and providing relief to communities. I have observed abundant creativity and innovation emerging at the national, institutional, organizational, and individual levels for the past year.
Now is the ideal time for initiatives like this to be explored, not only encourage development of innovation, but to manage future emergencies and crises.
Sejak mencapai kemerdekaan, Malaysia telah mengalami transformasi yang pesat demi kemakmuran dan kesejahteraan rakyat. Sektor kesihatan, antara sektor terpenting negara, sentiasa berhadapan dengan pelbagai isu dan cabaran dalam era globalisasi ini. Fokus Kementerian Kesihatan menjadi lebih luas, terutamanya dalam menyediakan kemudahan kesihatan yang saksama, mudah diperolehi dan berkualiti. Untuk itu, perancangan dan pelaksanaan program kesihatan negara perlulah berasaskan kepada bukti saintifik menerusi hasil-hasil penyelidikan yang berkualiti. Penubuhan Institut Kesihatan Negara atau NIH yang bernaung di bawah Program Penyelidikan dan Sokongan Teknikal Kementerian Kesihatan Malaysia adalah bertujuan untuk menjalankan penyelidikan yang mana hasilnya dapat memberi bukti saintifik terhadap pembentukan polisi dan intervensi bidang kesihatan. NIH telah diluluskan di bawah rancangan Malaysia ke-7 dan secara rasmi beroperasi sejak bulan Ogos 2003. Visi NIH adalah untuk menjadi organisasi penyelidikan kesihatan terkemuka ke arah meningkatkan kesihatan dan kesejahteraan negara. Manakala misi NIH adalah menjalankan penyelidikan, latihan dan perundingan berkaitan kesihatan yang berkesan dan berimpak tinggi untuk meningkatkan kualiti hidup. Selain itu, NIH juga bertanggungjawab untuk mentadbir dan menguruskan penyelidikan di negara ini untuk menangani isu-isu kesihatan nasional. Kompleks NIH seluas 40 ekar di Setia Alam Selangor mempunyai ciri-ciri seni bina moden yang melambangkan kerancakan transformasi perkhidmatan kesihatan yang dizahirkan oleh penyelidikan yang berkualiti tinggi. Dilengkapi dengan pelbagai fasiliti serba moden, NIH turut menekankan kepentingan ekosistem alam sekitar yang mampu mewujudkan suasana kondusif untuk penyelidikan. Kompleks NIH menempatkan sebanyak 6 buah institut yang mempunyai pengkhususan dalam bidang penyelidikan masing-masing. Kelancaran operasi setiap institut ini disokong oleh pejabat pengurus dan pejabat pendaftar yang menjadi tunjang utama dalam pengurusan strategik dan pentadbiran NIH. Institut Penyelidikan Perubatan atau IMR merupakan institut penyelidikan biomedical tertua di Malaysia yang diwujudkan sejak tahun 1900 oleh Kerajaan British. Ketika itu, ia dikenali sebagai Institut Pathology di Kuala Lumpur. Hasil penyelidikan IMR telah banyak menyumbang kepada pengetahuan, pemahaman, rawatan dan kawalan beberapa penyakit tropika utama di negara ini dan rantau Asia Tenggara. Kini, fokus IMR juga kepada penyelidikan bioperubatan seiring dengan trend perubahan isu dan beban kesihatan negara serta kemajuan teknologi perubatan. Sejarah Institut Kesihatan Umum IKU bermula di Singapura sebagai Royal Sanitary Institute dan dijenamakan sebagai Royal Society for Promotion of Health RSH yang berperanan melatih inspektor kesihatan dari Tanah Melayu, Singapura dan Borneo. IKU berkembang menjadi pusat penyelidikan epidemiologi dan kesihatan awam yang menyediakan data-data kesihatan penting pembuat dasar dan pihak berkepentingan mengenai prevalen penyakit dan taraf kesihatan rakyat negara ini. Antaranya adalah tinjauan kebangsaan kesihatan dan morbidity at National Health Morbidity Survey yang dijalankan secara berkala. Institut Penyelidikan Klinikal atau ICR berfungsi sebagai cabang penyelidikan klinikal KKM dan mula beroperasi sejak Ogos 2000. Dengan 5 buah pusat kajian yang berperanan menggerakkan kajian-kajian klinikal tersendiri serta mempunyai 36 cawangan di hospital-hospital utama KKM di seluruh negara. ICR memainkan peranan penting dalam menerajui pembangunan dan pengukuhan kapasiti penyelidikan klinikal negara, mewujudkan dan mengekalkan pengkalan data klinikal bagi KKM dan juga mewujudkan kerjasama dengan organisasi penyelidikan tempatan, serantau dan antarabangsa mengenai penyelidikan klinikal. Institut Penyelidikan Sistem Kesihatan atau IHSR ditubuhkan pada November 2002 bagi membantu KKM dalam pelaksanaan penyelidikan terhadap sistem dan pengurusan kesihatan negara yang membantu dalam menyediakan bukti saintifik kepada pengubal dasar dan polisi kesihatan negara mengenai taraf dan kualiti penyampaian perkhidmatan kesihatan kepada rakyat. Institut ini berperanan dalam melaksanakan penyelidikan berimpak tinggi dalam bidang penyampaian perkhidmatan kesihatan negara, melaksanakan penilaian terhadap dasar dan polisi kesihatan dan kebolehcapaian perkhidmatan yang saksama dan berkualiti dalam kalangan semua rakyat negara ini. IHSR telah mendapat pengiktirafan antarabangsa dan telah dilantik sebagai Pusat Kerjasama Serantau WHO untuk peningkatan kualiti dan kesihatan. Institut Pengurusan Kesihatan IHM bermula di bawah Institut Kesihatan Awam yang dikenali sebagai bahagian latihan pengurusan. Penubuhan IHM bermula pada rancangan Malaysia ke-6 yang mana ia bertanggungjawab dalam meningkatkan pembangunan modal insan profesional di KKM untuk menghadapi cabaran dalam penyampaian perkhidmatan kesihatan yang berkualiti. Bidang penyelidikan yang dipelopori oleh IHM ialah aspek kepuasan pelanggan, pengurusan sumber manusia serta pemantauan dan penilaian terhadap kualiti perkhidmatan kesihatan negara. Selain itu, IHM turut berperanan sebagai sebuah institut yang menyediakan latihan berkualiti tinggi kepada kaki tangan KKM. Institut Penyelidikan Tingkah Laku Kesihatan IPTK ditubuhkan pada 2005 adalah bukti bahawa bidang tingkah laku kesihatan adalah penting dalam usaha mencapai sebuah negara maju. IPTK bertanggungjawab dalam melaksanakan penyelidikan inovatif dalam bidang tingkah laku, penilaian intervensi promosi kesihatan, kaedah komunikasi kesihatan yang efektif dan komunikasi risiko. Penyelidikan yang dilaksanakan oleh penyelidik-penyelidik di NIH bukan sahaja telah memperbaiki penyampaian kesihatan kepada rakyat Malaysia, namun telah turut mendapat pengiktirafan di dalam negara dan di peringkat antarabangsa. Way Forward NIH akan terus mengkaji dan meningkatkan kepakaran para penyelidik ke arah menghasilkan kajian-kajian berkualiti dan berimpak tinggi dalam meningkatkan taraf kesihatan dan kehidupan rakyat Malaysia.
Ladies and gentlemen, our next lined up program is a knowledge sharing session. Please enjoy.
Hello to everyone. My name is Hon Kem from White House, Malaysia. Today, I want to talk about the topic regarding application of wearable devices, especially those are smart bands in NCT management. Before that, let me share some of the facts from our Minister of Health. According to the report, we have 67% of premature death is due to the NCT in 2014, and this already contributes 70% of the disease burdens. According to the 2019 National Health and Morbidity Surveys, 2/3 of Malaysia populations at least will suffer one of the three non-communicable diseases, namely diabetes mellitus, hypertension, and hypercholesterolemia. And these three types of the diseases is very difficult to handle because it's very chronic and cannot be managed by solely depend on medications or supplements or some of the single interventions. It really depend on our lifestyle and also what are the diet we are taking. So that's why a lot of different type of lifestyle intervention actually be offered. But mostly actually they offer in the offline, which we call the primary care facility like our clinics, pharmacies, and even wellness center. But this offline approach is normally have a lot of limitation. For example, we are normally apply one size fit all approach. That means we are using the one solutions to given for all problems or all people. And this will be very ineffective because different people may have different trigger risks. For example, due to the genetic factors, lifestyle factors, stress factors, work environment, and etc. Besides that, due to these offline limitations, all the practitioners actually only focus on product oriented. That means to prescribe some products or medications in order to cater these NCT problems. But due to the difference, like the risk factor that just now mentioned, it could be causing a lot of cost wastage by prescribing unnecessary or ineffective supplements or products to the patients. And besides that, we only can evaluate the result solely after a period of time by point of care methods, which is our blood test, and this could be lead to the disease program become more serious and too late. And that's why due to the offline interventions is limitations, and also advancement of our mobile applications, and also I believe that in our country 97% of people can be access mobile facility. That's why in the globally now they are developed with so-called mHealth interventions. Based on how actions process approved model, some researchers developed they call MyBrain 2.0 in order to apply this we call behavior change techniques to including the so-called action plannings to set a goal for our patients or user, and coping plannings to let our user to know that what is the obstacle, how to settle the obstacle in order to follow the intervention plan. And third, so after the certain period of time, let our user or patient to have self-monitoring by using mobile applications. And by this combination of action, copying, and self-monitoring, we hope to improve the physical activities and reduce the sedentary behavior of the patient, the user or public of the patients. But the problem of the mHealth for Smartband 2.0 is still using one-size-fits-all approach, which is the mHealth by Smartband 2.0 also facing that the different patients or different users, they have a different genetic factors, job environment, stress factors, and etc. So the failure rate actually is very high. And beside that, the drop-off rate also is very high because the patient actually is very easy to quit the interventions by just turn off or quit off the mobile applications. And the bound between the practitioners or provider and the user actually is bit low. And beside that, we also very depends due to the Smartband 2.0 also very depending of the questions and answer by the user, and this can be very biases and some of the inaccuracies because of depend of feeling of the user to answer the questions. They may not think that certain lifestyle interventions or certain diet is harm for them. And the last and but not least is the process of Smartband 2.0 a bit of complications because the patient need to be answer the questions every day in order for the system to know that the risk factor and also that is the progress of the patients. So what is missing in this Smartband 2.0 of mHealth interventions? What we, from our point of view, we need to have a one wearable device or Smartband to let our user to validate to gather the biometrics data directly from the body of the user rather than solely depend of Q&A. That's why we are design a model that integrate universally and skill agnostically by using Smartband or smartwatches like Garmin's, Apple Watch, Oura Rings, Fitbits, and even especially like BioStrap, which we are using for our design. From these Smartbands or those are like smartwatches, we can have this biometrics data directly generate our user. For example, heart rate variability, sleep quality, physical activity level, heart rate vitals, respiratory rate, and body temperatures. But this kind of information, from what we see, that is very difficult to understand or very difficult to interpret even by the healthcare practitioners. For the user, even for the layman user, much more difficult to understand. That's why we developed algorithms, what we call that is the Vitals algorithms, Vital score algorithm, to classify our body stress level to the three, we so-called the recovery stress profile, to a three simple primary indicator. For example, like green will represent low stress, chronic stress will be yellow, and acute stress will be red. And based on these color distributions, we generate a daily, weekly, and monthly view for not only for our user, but most important for our practitioner, healthcare providers, to much more easy to understand our user or their patients, the conditions and the trends. Like what in our report, we can see that is the daily color zone, the score, stress factor indicator, the distribution of the money color zone, and also that is the activity is acquired in our application. We so call that is for our patients. So what are the daily activity? What are the diet they are taking? Their sleep hours, and beside that, which of the day actually is contribute the more high stress of our user or patients, And also that we even can understand the compliances, whether the patient actually have a behavior change, and the behavior change whether is improving the conditions or reduce conditions. According to this data, we also set before we recruit the user, we also set a very clear goal objective for our user. For example, how many % of green the user have to be achieved. For especially for NCP, minimum of the 60% and above that our patient have to be achieved in order to gather the we so-called is a satisfied result. So from the solutions that actually we are through our vital algorithms based on the biometrics and the data generated from the IoT, the Smartband. So we are enhancing the PCT, the behavior change techniques, that which is action planning to set a very clear goal and objective to our user, which by using the color zone, how many % of the green that our user have to be used, how many % of yellow, and how many % of the red. And also that is based on the daily, we so-called the color zone, the SMS of WhatsApp actually will be given to our patients regarding the previous day of activities actually is to contribute what type of the color stress level of our user in order they do a rectify and also the understanding what is the risk factor for them to overcome. And that is the self-monitoring. Based on the certain period of times, normally is 1 month, the patient will start self-monitoring to adjust their lifestyle intervention by themselves and overcome the lifestyle to understand the risk factor contribution, and after that they will adjust by themselves. And of course, the color zone also serves a very good indicator for them to warn them to change their lifestyle on the spot rather than waiting for 2 months, 3 months, or even longer period of time. And from the color zone, we can what we know, especially for the healthcare provider and also the practitioners. So we know the daily response for our user or patients regarding the lifestyle interventions. And beside that, we also can understand what are the patient lifestyle risk patterns, what are the we so-called is the diet, certain of diet, certain of physical activity, or certain of hours of the type of the exercise, and even though certain of the environments actually contribute the high stress to our patients. And also, the most important that is we will know that whether the patient is compliances of change or not. If patient have not complied to apply any changes in their lifestyle interventions, so we will give them a remind and motivation text that actually to encourage them to change. So from that information, actually we can tailor a personalized dosage of our supplements or even our diets and lifestyle interventions, and realign interventions by daily, and to understand the risk factor, the lifestyle risk factor from our patients and adjust accordingly, and improve our patient compliance by texting them every day in the morning and give them a motivation to follow the change in order for them to develop and sustain the behavior change. Generally, what we do actually, we are using the biometrics to gather all the we so-called as information to generate by the individual devices to pass through our in-house proprietary algorithms and derive a vital color zone system for easier interpretation and diagnosis between patient and healthcare provider. The patient, what they need actually do to sync their biometrics data in the mornings, and the data actually is in the third-party smartwatches or smart devices like BioStrack and also the iWatch, and go through our server. From our server, we have calculated the color zone. After that, we send the recovery stress profile generated to the provider and also the user in order And the SMSs or messages, WhatsApp messages will send to the user to remind them that what happened to the yesterday and recover the recovery stress score in order to change their lifestyle interventions or their planning in the future, the planning of the day, that how to rectify accordingly. And this is a generally we are actually leverage of the advantage of the internet, I think, for our in order for helping the healthcare provider to apply the behavior change techniques to more effectively by deliver a very personalized lifestyle interventions based on daily intervention analysis. So to understand the intervention impacts individually. And beside that, multi-phase approach. They're using patient own lifestyle in order to fine-tune and readjust to redesign the most easy way for our user to apply their lifestyle interventions according their lifestyle, which is lifestyle habit which is they are developed since their childhood. Though this is actually to improve the compliances and the success rate of the behavior change. And this is very personalized because everyone have the different lifestyle interventions and everyone have the lifestyle diet plans and also that physical activity really depending by their vital score. And let me share a bit that some are two of our use case, our subjects. The first one actually is a male 50 years old engineers which having a type 2 diabetes. So we set up the unit for him and set the goal for 60% of green for within 3 months. From the data, you can see the patient after the 3 months, he can achieve of 65.1% of greens as 18.6% of yellow and 16.3% of red. And from the result that what we can see for this one, the average for the first 3 months, the patient HRV actually is improving and the score actually is improving drastically for these 3 months. And the HbA1c result from the patient period from the study is 11, and after the 3 months, we re-evaluate and test the HbA1c, he dropped until 6.7. And this is the second case from the lecturer, a senior lecturer from one local university, which have obesity and hypertension. We also set a goal from this subject for minimum 60% of greens, and he achieved the 64.4% of greens and 28.7% of yellow and 6.9% of red in our vital scoring. And this is what are the patterns of the first 3 months from the November and to the January, and even February, where we can see the mean HRV and also our vital score actually is improving within the 3 months. Under vital scoring system behavior change intervention programs, you can see that his body weight have a very drastically obvious change. His body weight start from 87 before the programs, and after 2 months, his body weight dropped to 69 kg. His blood pressure also start from 160 over 100, dropped to 110 over 60 within these 2 months interventions. And this is proof that under vital scoring system, we can help our user by using IoT biometrics informations to not only that help him more easy to comply the interventions, and more so to help him to sustain the behavior change in the programs. Before I end up my presentations, I would like to share our corporate video to explain more detail of our vital score principle and also the applications in chronic illnesses.
You're seeing a healthcare provider. He performs a blood test and asks you some questions about your lifestyle. Based on that brief session with you, the practitioner gives you his opinion on how best to manage your disease. But what if you didn't tell him about the late-night fried chicken and ice creams you frequently take? What if the intervention plan was inadequate, or the dosage of medication was over or underprescribed? These are some reasons healthcare as we know it today is sometimes ineffective, costly, and untimely. What if there is a better approach? At Vitals, we believe this gap is best bridged by a continuous monitoring approach that is based on reliable and timely biometric data of the patient. Using wearables technology, the biometric data is obtained and synced to the Vitals platform where it is mapped to the user's risk profile and empirical data. The data is then analyzed using our proprietary Vitals algorithm, which would produce reports summarized by a color-coded Vitals score that indicates the user's body recovery stress. With insights into users' data, healthcare providers can evaluate their user conditions on a daily basis and provide solutions in the best interest of the users. At the same time, users are given daily tips on their lifestyle and most importantly, they can finally have access to a precise health intervention program that is truly personalized, effective, and affordable. Vitals, advancing personalized healthcare.